At RMIA, we find it helps patients to understand the financial aspects of IVF, as well as the various IVF programs we have to offer. Our website is a very helpful tool in finding answers to questions you may have, and I encourage you to utilize it as a source of information. Coverage for IVF and related services can vary from insurance plan to insurance plan. At RMIA, we have a dedicated staff to help you understand your insurance coverage for consults, diagnostic testing, treatment, and medication. The more you are aware of your coverage, the better prepared you are in order to pick an IVF program that best fits your needs. We try to help you understand through our expertise and through discussions with your insurance carrier what you can expect as far as potential coverage. Please understand that a guarantee of benefits cannot be made until a claim is actually submitted. We encourage all of our potential patients to contact their insurance companies to determine coverage for the various services they will be undergoing at RMIA. There are two segments that we discuss with patients to help them better understand the cost aspect of IVF. The first is non-IVF service or services that are provided prior to the actual IVF procedure. These services generally include pre-screening or general testing, cycle monitoring, medications, and pregnancy tests, as well as surgical or facility fees if applicable. The non-IVF services would add to the cost of your IVF procedural cost. The non-IVF services may or may not be covered by your insurance, and it's important to understand the potential added costs associated with your IVF program. Pre-screening is individualized to the particular couple and is determined by your physician at RMIA. The cost of pre-screening services can vary depending on what screening services are needed and the particular insurance coverage a patient may have. The cycle monitoring consists of ultrasounds, blood work, and office visits needed to determine how your ovaries are responding to the medication. RMIA offers patients the option of coming to either of our sites for cycle monitoring and/or doing the cycle monitoring with one of the many satellite clinics we have throughout the state as well as throughout the country. If you wish to have your monitoring done outside of RMIA, it will need to be approved by the RMIA physician. Not all clinics can provide the services that we need in the timely fashion that is required. Working with local physicians helps to cut down on the amount of trips patients need to make to RMIA and provides convenience to our patients seeking IVF services. Medications are received through a pharmacy. The patient can have their medications called into a pharmacy of their choice. For those patients without the benefit of insurance coverage, we do recommend what is called a mail order pharmacy to help reduce the cost of medications versus getting the same medications through a retail pharmacy. Medications and monitoring are per fresh and per frozen cycle, meaning you incur the cost per cycle when you're going through a fresh or frozen cycle. The cost for frozen monitoring and medications is less than a fresh cycle since the stimulation medications are not needed for a frozen cycle. RMIA offers a variety of programs based on meeting our criteria of our IVF programs. The first IVF program is a regular fee-for-service IVF cycle. The regular cycle is a base cost for retrieval, fertilization, and fresh cycle transfer. There are potential added extra costs associated with the IVF base cost. Those can include charges for ICSI, assisted hatching, cryopreservation, extended culturing, storage of embryos, and frozen embryo transfers in the future. Charges that are known up front will be discussed with you so that you have an accurate cost for your regular IVF program. Under the regular IVF cycle, the patient accepts the financial risk associated with fee-for-service cycle. A majority of our patients that come to RMIA for IVF choose one of our programs designed to share the financial risk. This includes a fertility cost warranty program and our HOPE program. Both offer qualified couples an opportunity for up to 3 fresh cycles of IVF, with success under the program is being defined as a live birth plus 30 days. The warranty program cost is based on the female's age at the time that they sign the informed consent with the RMIA physician. A fresh cycle of IVF under the warranty and HOPE program is defined as 1 ovarian stimulation and egg retrieval, followed by the transfer of all fresh and cryopreserved embryos, if any, back into the female. As mentioned before, the warranty cost is based on the age of the female. Females have to be less than 39 years of age to qualify for the warranty and meet other medical criteria and laboratory screening requirements. The program offers patients a substantial amount of their investment back if they are unsuccessful. This allows the patient to pursue other options such as adoption in the future if their IVF program is unsuccessful. Included in the warranty program are the retrieval, fertilization, transfer of fresh and corresponding frozen embryos, ICSI, assisted hatching, cryopreservation, extended culture, and embryo storage for 1 year. Keep in mind that the medications and monitoring are in addition to the cost of your warranty program and are based on a per-cycle basis. Under the HOPE program, women less than 35 years of age can qualify based on meeting pre-screening requirements. The HOPE program was created in November of 2006 and includes the same services that are included in the fertility cost warranty program, but also adds the stimulating medications needed for each cycle. Monitoring must be done through RMIA or an RMIA-approved satellite clinic under the HOPE program. Under the warranty and HOPE programs, patients have the right to opt out after a completed unsuccessful cycle and receive the refundable fee for their program back. You are not contractually bound to do 3 fresh cycles, but rather given up to 3 fresh cycles. If you decide to stop and leave the program before all the embryos are used, the program would revert to fee-for-service, and RMIA would assess charges for that cycle against the refundable fee and refund the difference back to the patient. RMIA also offers 3 fertility cost warranty programs for women wishing to utilize donor egg. The programs include all of the services for the donor: screening, medications, monitoring, retrieval and compensation, as well as the recipient's fertilization process, fresh cycle transfer, ICSI, assisted hatching, cryopreservation, extended culture, and embryo storage for 1 year. Keep in mind, under the warranty donor program, you can use up to 3 different donors, and the cost of the donor is incorporated into the predetermined cost for your warranty program. Just a few housekeeping items. RMIA does reserve the right to change our pricing and program content. Couples will be locked into the price upon the pre-screening orders being cut by our RMIA physician, and assuming the patient completes the required pre-screening requirements in 60 days. RMIA's IVF programs are based on meeting the criteria set forth by RMIA. If you have any questions regarding the criteria, please talk with your physician or somebody in the business office at RMIA. Infertility Laboratory and Surgery Center is a separate corporation that does not participate with insurance carriers for 3 services that we offer: IVF or in vitro fertilization, andrology services, and surgery or facility fees. Services under Infertility Laboratory and Surgery Center will be collected in advance, and a claim will be submitted on the patient's behalf. Once the claim has been addressed by the insurance carrier, an explanation of benefits will be submitted to the patient as well as RMIA, and we will reconcile your warranty and/or HOPE account. I hope this portion of the presentation has been helpful, and we look forward to meeting with you in the near future.